We're Catalina Aguayo, Montserrat Carrasco, and Javiera Saavedra. And today we're going to talk about Obsessive Compulsive Disorder, or OCD. It's a mental illness that causes repeated unwanted thoughts or sensations. Obsessions are the urge to do something over and over again. Compulsions. There are two types of obsessions. Overrated are those which are understandable according to the history of the subject. They occur specifically in OCD when the insight is lost, and delusional are seen as non-normal by the sufferer itself. They are anxiety generators that do not change with the victim's history. And compulsions. These are repetitive behaviors or thoughts that a person uses with the intention of neutralizing, counteracting, or making their obsessions go away. People with OCD realize this is only a temporary solution, but without a better way to cope, they rely on the compulsion as a temporary escape. It can also include avoiding situations that trigger obsessions, and these are time-consuming and get in the way of important activities the person values. There are different types of OCD, such as checking locks, alarm systems, ovens, or light switches, or thinking you have a medical condition like pregnancy or schizophrenia. Symmetry and ordering. You need to have things line up in a certain way. Contamination. Fear of things that might be dirty or a compulsion to clean. Mental contamination involves feeling like you've been treated like dirt. Rumination and intrusive thoughts. Obsession with a line of thought. Some of these thoughts might be violent or disturbing. OCD symptoms. You cannot control your thoughts or behaviors, even when you know they are excessive. You spend at least 1 hour a day on these thoughts or behaviors. You don't enjoy presenting these behaviors, but doing them may briefly relieve you of the anxiety your thoughts are causing. You have major problems in your daily life due to these thoughts or behaviors. There are risk factors like family medical history, people with first-degree relatives, parents, siblings, or child who have OCD have a higher degree of risk, and the structure and function of the brain. Imaging studies show that people with OCD have differences in certain parts of the brain. In addition, there is less activity of the MAO-A enzyme.
Risk factors: childhood trauma and stressful life events. People who experience traumatic or stressful events may trigger the intrusive thoughts, rituals, and emotional distress characteristics of OCD. Streptococcal infection. In some cases, children can develop some symptoms or OCD after a strep infection. This is called pediatric streptococcal autoimmune neuropsychiatric disorders, PANDAS. Diagnosis. The first step is to talk to your doctor about your symptoms. Your provider should do an exam and ask about your medical history, making sure to rule out that a physical problem is causing your symptoms. Not everyone with obsessions or compulsions has OCD. Intervention. Occupational therapy has a lot of interventions that therapists can provide to better the lives of those who have obsessive-compulsive disorder. They intervene, establishing strategies to be in better control of the effects of the disorder. The therapist provides activity-based therapy for OCD patients. Rapport building. Having a trusted communication between the therapist and the patient. It establishes a positive bond between them and helps the therapist bring positive changes in the patient. Relaxation techniques. Therapist teaches relaxation techniques and some lifestyle changes, both which can help reducing anxiety-provoking situations. They can help the patient identify and reduce environmental triggers that can stimulate obsessive and compulsive thoughts. Desensitization techniques. The patient is asked to make a hierarchy of the obsessions and grade them. This way, therapists can start working on the low impulsive thoughts and progress from there. Specific activities. Graded activity. The therapists ask the patient to do a specific task that is given. This way, if the patient completes the task, they feel satisfaction or the feeling of a fully completed task without anxiety or obsessive thoughts. Purposeful activity. The therapist asks the patient to perform their favorite meaningful activity or hobby. This way, if they are comfortable, they will do it easily and enjoy it at the same time.
Now, some data of the prevalence of OCD. First, on issues of age range and gender, studies show that in the infant stage, it is women who suffer from OCD mostly. Then, in adolescence, this varies because it is men who suffer more than women. With the passage of time in adulthood, this comparison reaches a balance, with women narrowly taking the lead. On the other hand, OCD is among the most frequent psychiatric disorders. Of those people who suffered or have suffered from OCD, 50% had the first symptoms before the age of 20. If we continue the timeline, we can see that 84% had them before the age of 35. Here are the percentages of comorbidity, which is a term used to describe two or more disorders or diseases that occur in the same person. Studies verify that 55% of people with OCD also have major depression, 14% psychosis, 20% general anxiety, and 11% social phobia. A short-duration illness of low severity that is treated early and intensively with continued maintenance treatment over the time possibly has a good outcome. Recent studies have also identified neuroimaging and neuropsychological correlates of good outcome, but these need further replication. Finally, the expected outcomes. Studies have revealed that the long-term outcomes in OCD are not necessarily bad, and at least half the patients with OCD who need treatment show suspension of the symptoms over a long period of time. Thank you for your attention.